You know, if you're a parent or even a grandparent, you've probably been around or still have a lot of small kids running around the house. Well, if they ever have a tummy problem, they come up to you and say, Mommy, Daddy, I got a tummy ache. You might just blow it off and say, they ate something bad, but it could be something serious. So today we're talking to Dr. April Ulmer, the tummy doctor here at Singing River Health System. How are you?
I'm wonderful, thank you.
Well, it's good to talk to you.
You as well.
Give us a little background, if you would, Dr. Ulmer, about how you started and everything, where you went to school.
Well, I'm from right here in Mississippi. I grew up in a small town called McGee. From a very young age, I knew I wanted to, pursue a career in medicine. So, went to college in New Orleans, but went to UMC in Jackson for medical school. Completed my training up the East Coast, did a fellowship in New York, met my husband, and, just missed Mississippi. So after fellowship, we came right back to Mississippi, and we've been here since. Been here for, over 15 years.
Wow.
Yeah.
Now, you are a pediatric gastroenterologist.
That's right.
Yeah, say that 5 times fast. Tell us exactly what that is.
Okay, so pediatric gastroenterologists focus on the health and welfare of the GI tract of children only. And so when I say children, my patient population is typically newborn to 21. Kids can have lots of different GI diseases and symptoms, but truthfully, pediatric gastro is a completely different specialty than adult gastroenterology. A lot of people think, well, GI is GI, the only difference is the size of your patients. Well, it's really different because the things that we worry about kids and sort of what they suffer with and what they get, and also just the way that we look for it is completely different. So, that's what we focus on.
Now, every child eventually is going to have some type of gastro problems or anything like that. And what kind of issues do you deal with them?
I deal with everything from tummy pain, where we just have to figure out what it means. I mean, that's one of the most common complaints, and especially when you're dealing with children. One of the things about pediatric gastro and just pediatrics in general that can be difficult, but is also rewarding for me, is sort of deciphering what it is that a child is trying to tell you. So for lots of kids, they'll say, "Oh, my tummy hurts," but that could mean, "Oh, I need to have a bowel movement. I have heartburn. I'm hungry. I ate too much." So when a child comes in with tummy pain, it's my job to really kind of work through by talking to the child on their level, in their language, as well as getting the history from the family to figure out what they're dealing with. So, that's one of the most common sort of general complaints. But I'll tell you, here on the Gulf Coast, one of the things that I see really, really commonly as far as a diagnosis is gut allergies. Lots of times people, when they think about allergies, they're thinking about peanut allergies, right? What am I going to get and hive up and swell up and can't breathe? Well, the GI tract is a completely different pathway. And so when it comes to gut allergies, it can really look like anything. We know that, the incidence here on the coast is way higher than national average. It can look like anything, and it can start as early as a newborn and just persist into childhood, but the look of it and the symptoms can change over time. So that's something that's really a hotbed of research. It's of particular interest to me because I see it so often. It takes real, sort of skill to diagnose it and identify it, but it's very treatable, and you can really make a huge difference in the lives of children.
What are some of the signals that the parents should perhaps look for to determine whether this could be, like you said, simple as I've got gas, I need a bowel movement, or it could be something very serious?
Persistence of symptoms, definitely if you have a child where, they keep complaining, maybe not every day, but it just seems like they just won't stop, So that's something to look for. Definitely an escalation of symptoms, like more severe symptoms, they're complaining more frequently. There are these things that we call red flag symptoms, definitely weight loss, persistent vomiting, anything that awakens a child in the middle of the night, diarrhea, blood in the stool. Those things are kind of, wow, I need to get in there to see a doctor. But, just sort of a rule of thumb, or, sort of what I love to tell parents is, listen, if you're worried about it, I'm worried about it. It doesn't mean it's catastrophic, but it's something that I can help you in, right? So if it worries the parents, I want to see those parents because, I can help make it better. And that's what it's all about.
So how do you differentiate between infants and say, older children, 3, 4, 10, 12, something like that?
Right. Well, definitely, there are diseases that can look different at different ages. One of the things, let's say reflux, for example. I'll tell parents that, infants sometimes get reflux and it's physiologic. Sometimes it's bad enough to need treatment. They're kind of a setup for it. I mean, infants are on an all-liquid diet. They spend a lot of time on their back. They're floppy. So they can have physiologic reflux, but they're supposed to outgrow it. If I have a child who is school age, who is consistently refluxing, it's not normal, okay? okay? They may be refluxing, but that's a symptom of something else. Same thing with my older children. So the best way to approach it is whenever I see a child, I talk about what they're doing at that moment and whether or not it could be physiologically normal, but maybe something that they just need help with, or if it could be a symptom of something bigger, okay? So that is just, you know, it's on a patient by patient basis, and it's all about just listening, you know, and that's one of my favorite things is, you know, like I said, you know, I'm a talker, so I love to talk to the families, I love to listen to them, and that is really what helps me the most, do the best by them.
Well, I remember when my daughter was newborn and everything, and she'd be crying a lot and everything. My mom would say, "Oh, she's got colic." They got colic and everything like that. Do you see a lot of that?
You know, I'll be honest with you, even though colic is sort of this nebulous thing that floats out there, you know, with my patients, I've never diagnosed a child with colic.
Really?
Right. Most babies who come in, if they're up all night screaming, there's a reason. And so once again, it's about deciphering exactly what it is that they're trying to tell you. And, you know, sort of, you know, that also speaks to the fact that, you know, I see lots of parents with babies who are screaming and they come in and they look at me and they just want help, you know. And that is, I think, my favorite part of the job. You know, it's just to tell them, listen, you're doing a great job. Your baby's healthy. We're going to fix this. You know, I love to tell, especially my parents who have young babies, and you just see the desperation in their face. You know,
especially first-time parents.
Exactly, but even parents who have other kids. You know, if you have that baby that just won't stop. You know, I always tell the story. You know, my oldest daughter, who's 14 now, when she was first born, despite knowing everything that I know as a pediatrician, I've been a practicing pediatrician for a long time at that point. But my poor husband, I always say, you know, when he took home, you know, our daughter, he actually took home 2 babies because she would cry and I would cry. She would cry. And I tell parents that because it just sort of emphasizes the fact that
you feel helpless.
You feel helpless, and we've all been there. And I think that once they understand that, listen, I'm there with you. I'm here to help you because I've been there. I understand. Then I think they feel that. They feel that earnestly, I'm here to help, and together we're going to figure it out, and we're going to make it better.
Got about a minute and a half left. So if someone comes in for their first gastro-pediatric appointment, what can they expect?
Yeah, you know, we'll sit and we'll talk. You know, one of the first things I say when I walk into a room with a child is I say, listen, I don't do any shots or ouchies here. And you just see like the stress melt away. And we just sit, I do the exam, and then we talk about a plan together. You know, I like to lay out options for the parents. I'll tell them sort of what I feel is the best option. And then we get to work, okay? But as far as making an appointment, we don't require a referral at Kids and Tummies. You know, you can just give us a call, and you know, we focus on taking care of our kids and getting them in ASAP.
So, and if they do need to make an appointment, I guess they can call your office?
Absolutely. Call our office. You can go to our website. You can learn more about our practice.
Oh, there's
there.
a great, she's got a great website. She really does. I found out a lot of stuff about you. That's where I found out she's called the Tummy Doctor.
Oh, we'd like to keep it fun. So.
Yes, it definitely is. Well, Dr. April Ulmer, thank you so much. It's a pleasure meeting you. You made me wish I had some small children, but my daughter's 43 years old now.
Wow.
And I've got a 10-year-old grandson.
Okay, well, there you go.
They live far away from here. But anyway, if you're your child having some stomach issues or whatever, I know you don't think about taking them to a regular gastroenterologist. You take them to a pediatric gastroenterologist, the tummy doctor, Dr. April Ulmer. She's part of the Singing River Health System. Information's on your screen. If you need to make an appointment for one of your children, give her a call.